Hello everyone. So far we have been doing health promotion and counseling from family medicine in the previous videos. So we have covered till dyslipidemia in the past two videos. First was part 1 where I was covering the family medicine aspect. The other part I was covering the endocrinology aspect. How you have to cover family medicine chapter from Toronto notes is that you have to follow whatever they tell you to read from. Let's say this was dyslipidemia that we discussed in the previous chapter. You see here it is written endocrinology E3. So that means this dyslipidemia would be covered only if you cover it from endocrinology as well along with family medicine. So make sure to follow these steps from family medicine chapter. You see they have also mentioned endocrinology E6. That's what we have covered already from the previous video, and that's the pharmacological part of that. So we can even cover when we start endocrinology. So it's up to you if you want to do go system wise or you want to do it according to family medicine. I would suggest you start with just one topic. You cover the MCC objective of that topic, the one that I told you in the previous video, and then make sure you cover it from the other chapter as well, like we did in the previous video. Now since you have covered dyslipidemia already, today's topic is exercise. Okay, exercise is a very important component of QE1. Why? Because in most of the questions, they want to know how much of exercise are you going to recommend to a patient, right? So let's just read this part first and then we'll get into the table. So, epidemiology is 25% of the population exercises regularly, 50% occasionally, and 25 is sedentary. So that means half of the population is occasionally exercising and half of half, that is 25, is regular exercising, or 25% is sedentary. What is the management? Assess the current level of fitness, motivation, and assess for exercise. So first you have to assess. You have to ask questions like how interested are you in, having a maintained weight. How do you think about losing weight? These are the questions that you're going to ask, and give the patient a prompt to speak about fitness and their motivation and assess their level of exercise. Encourage warm up and cool down periods to allow transition between rest and activity and to avoid injuries. So you have to encourage patient to do warm ups and cool down. Exercise with caution for patients with coronary artery disease, diabetes mellitus, because of the risk of hypoglycemia in diabetic patients, and exercise induced asthma. So these are the three conditions we have to be careful when you are telling the patients about exercise. One is asthma. Why? Because exercise induced asthma can be exacerbated. Diabetic patients can have hypoglycemia, and coronary artery disease can have angina or chest pain. Patients with known coronary artery disease should have cardiac assessment prior to commencing exercise. Benefit of exercises: reduce the risk of premature death, heart diseases, stroke, hypertension, types of cancers, type 2 diabetes, osteoporosis, overweight, and obesity. Leads to improved fitness, strength, mobility, functional independence, and mental health, morale, and self-esteem. So these are few benefits of exercises. You don't have to memorize everything from here. Just quickly let's get to the table. So this is a Canadian 24-hour movement guideline. So in an infant who is less than 1 years of age, the physical activity guideline is active several times during a day in a variety of ways. Accumulate more than 30 minutes per day of tummy time while awake. Examples are given: interactive for floor-based play, including tummy time, reaching for toys, crawling, and sleep is 14 to 70 hours till 3 months of age, and then 12 to 16 hours per day till 4 to 11 months of age. And a good quality sleep, including naps with consistent bed and wake up times. Sit not restrained, that is in stroller, for more than 1 hour. Screen time not recommended. And engage in reading and storytelling when sedentary. So what you have to remember in this table is you need to remember how much exercise are you going to tell, what are the kind of exercises like floor play, tummy time. More than 30 minutes per day of tummy time should be remembered. Number one. Screen time: how much screen time is recommended for an infant? There's no screen time that is recommended for infant less than 1 year. And they should not sit for more than 1 hour in a stroller and till the age of 3 months. And then sleep should be 14 to 17 hours per day till 3 months, and 12 to 16 hours per day for till 11 months. So good quality sleep. Okay. For toddlers who are 1 to 2 years of age, accumulate more than 180 minutes of physical activity at any intensity spread throughout the day, including energetic play. Moving around the home, climbing stairs, exploring environment, brisk walking, running, and dancing. So there's nothing specific, just moving around the house, exploring the environment. And hours of sleep is 11 to 14 hours of good sleep, including naps with consistent bed and wake up times. Not restrained for more than 1 hour. Sedentary screen time not recommended. Till age of 2, there's no screen time recommended. Less than 1 hour screen time for those who are age 2. So in Canada, according to Canadian guideline, the children with less than 2 years of age, there is no screen time recommended. But if the child is more than 2 years of age, you will recommend screen time of less than 1 hour for children who are two or more. Okay, so less than 1 hour of screen time. Engage in reading, storytelling when sedentary. So the most important thing here is a screen time thing, and then you can have an approximate of like what activities are recommended, and what are the things, and how long should be the child should be left for tummy time or maybe the physical activity. Preschool ages 2 to 4 years of age, more than 180 minutes in a variety of activities at any intensity, including more than 60 minutes of energetic play throughout the day. Moving around the home, climbing stairs, exploring environment, brisk walking, running, and dancing. So all those things like dancing, running, playing around the house. The hours of sleep is reducing to 10 to 14 hours per day of good quality sleep, which may include nap. Sit not restrained in a stroller for more than 1 hour. Sedentary screen time less than 1 hour. Less is better. Engage in reading and storytelling. So till 4 years of age, it should be ideally kept to less than 1 hour. Okay, it starts by 2 years of age, but should be kept by 4 to less than 1 hour. Now comes 5 to 11, or youth 12 to 17. Accumulate more than 60 minutes of per day of moderate to vigorous aerobic intensity exercise. So you see, in toddlers and preschool, the timings were more than 180 minutes, whereas in the infant it was more than 30 minutes. But now it is coming to reality, which means around 60 minutes per day of physical activity, muscle, bone strength training exercises 3 days a week. So this is what we usually recommend. Mostly, aerobic exercises 3 days a week, a variety of structured and unstructured light physical activity. So bike riding, playground playing, running, swimming, and hours of sleep is 9 to 11 for till 13, and 8 to 10 till 17. Uninterrupted with consistent bed and wake up times. No more sit no more than 2 hours per day for recreational screen times. Limit sitting for extended period of hours. To avoid sitting for long period of hours, and 2 hours approximately. A young patient should sit. And then what you need to remember in this whole scenario is 3 days of exercises per week. And this sitting time should be less than 2 hours, and the screen time should be less. Should not They have not specifically mentioned anything about screen time in youth, but it should be less. Less is good. Okay. And yes, they said no more than 2 hours per day of recreational screen time. So recreational screen time should not be more than 2 hours. Adult age 16 to 60, 18 to 64, 150. This is something that you need to remember for QE1. Accumulate 150 minutes per week of moderate to vigorous intensity aerobic physical activity. And even in practical life, you have to recommend your patients with hypercholesterolemia, hypertriglyceridemia, that they have to exercise 150 minutes per week of moderate to vigorous and intensity physical activity. In bouts of more than 10 minutes, muscle and bone strengthening activities using major muscle groups for more than 2 days per week. Moderate is brisk walking, bike riding, vigorous jogging, cross country skiing. Sleep is 7 to 9 hours per day of good quality sleep with consistent bed and wake up time. Limit sedentary times to 8 hours or less. No more than 3 hours per day of recreational screen time. Break up long periods of sitting as possible. So it is encouraged to break up those long period of sitting, and you should limit the sedentary time to 8 hours or less, and sitting should be no more than 3 hours per day for recreational screen time. In more than 65, same as adult as above, physical activities as challenge balance, same as adult as above. Those with poor mobility should perform physical activity to enhance balance and prevent falls. So this is overall guideline. In this entire table, what I would encourage you to learn is less than 2 years of age, no screen time is recommended. If 2 years or more, less than 1 hour of screen time is recommended. If the child is in preschool or toddler, more exercise, more than 180 minutes is recommended. If the child is young patient, then more than 60 minutes of exercise. If it's an adult after 18 years of age till 64, more than 150 minutes of exercise. Okay. Screen time usually is more focused in the young children, and then as you get older, you have to remember 150 minutes of exercise, aerobic vigorous intensity aerobic exercises, and then the screen time should be less. Should not sit for more than 2 hours or more than 3 hours of recreational screen time. Okay. So this is a basic thing that you have to remember about exercises, nothing much. Okay, so now in the next video we will continue smoking cessation. I hope you like this channel. Please make sure to subscribe to this channel, like these videos, and comment down if you guys have any questions, or specifically if you guys want me to cover any chapter from Toronto Notes. So right now we are continuing the family medicine series of the videos. Okay, so good luck to you guys. Thank you for watching.